Some conditions can look like autism, but are treatable or highly supportable. This is not about denying autism. It is about making sure nothing else is being missed. Many parents begin this journey because something feels off. Their child has speech delays, frequent meltdowns, sensory overload, or trouble focusing. Some children seem distant or checked out. Others are constantly overwhelmed. These signs can be frightening, especially when you do not know why they are happening. Here's the most important thing to remember. You do not have to guess, and you are not doing anything wrong by asking deeper questions. There are medical, developmental, and emotional conditions that can mimic autism or exist alongside it. Many of them respond well to treatment and support once they are identified. One of the simplest places to start is hearing. Hearing loss or chronic fluid in the ears can look like ignoring you or not responding to name. At home, parents might notice that their child turns the TV volume up, startles easily, or seems confused when spoken to. With a doctor, treatment may include hearing tests, monitoring ear infections, antibiotics when needed, or ear tubes to drain fluid. When hearing improves, speech and engagement often improve as well. Vision is another commonly missed factor. Vision problems can look like poor eye contact, clumsiness, or frustration with reading and puzzles. At home, children may avoid visual tasks, rub their eyes, or become easily frustrated with fine motor activities. With a doctor, a full eye exam may reveal the need for glasses or vision therapy. Supporting vision can reduce frustration and make learning feel safer and easier. Sleep disorders affect nearly everything. Poor sleep can cause irritability, emotional outbursts, poor attention, and learning difficulties. At home, parents may work on consistent bedtime routines, reducing screen time before bed, and creating a calm sleep environment. With a doctor, sleep studies may be ordered to check for sleep apnea, restless sleep, or other disorders. Treatment may include addressing breathing issues, iron supplementation for restless sleep, or behavioral sleep interventions. Better sleep often leads to noticeable daytime improvements. Anxiety is another major contributor. In children, anxiety often shows up as rigidity, shutdowns, avoidance, or meltdowns. At home, reducing pressure, offering predictability, and validating feelings can help. Teaching simple coping strategies like breathing or using visuals for transitions can reduce stress. With a therapist or doctor, cognitive behavioral approaches, play therapy, or family-based therapy may be used. In some cases, medication may be considered. Treating anxiety often leads to more flexibility and emotional safety. ADHD can overlap with autism or be mistaken for it. ADHD can cause impulsivity, sensory seeking, emotional dysregulation, and difficulty with transitions. At home, supports may include structured routines, movement breaks, visual schedules, and breaking tasks into small steps. With a doctor, evaluation may lead to behavioral therapy, school accommodations, or medication. For many children, proper ADHD treatment reduces overwhelm and improves daily functioning. Language disorders are another important area. When a child struggles to understand or express language, social interaction can be exhausting. At home, parents may simplify language, use gestures or visuals, and give extra processing time. With a speech-language pathologist, therapy focuses on building understanding, expression, and communication strategies. Improving language skills often reduces frustration and behavioral challenges. Trauma and chronic stress should always be considered. Trauma does not require a single dramatic event. Ongoing stress, medical trauma, instability, or feeling unsafe over time can all affect development. At home, creating predictable routines, offering emotional reassurance, and avoiding punitive discipline can help rebuild a sense of safety. With trained professionals, trauma-informed therapy helps children process experiences and learn regulation skills. As safety increases, behaviors often soften. Now we come to a condition that is especially important and often misunderstood. Cerebral folate deficiency, or CFD, is a medical condition where folate levels are low in the brain even when blood folate levels are normal. This is not behavioral, it is biochemical. CFD has been identified in some children with autism-like symptoms, including language delays, regression, seizures, irritability, attention problems, and motor difficulties. In some cases, antibodies interfere with folate transport into the brain. This matters because CFD is treatable. At home, treatment is guided entirely by a physician. Families may notice improvements gradually, such as better language, attention, or emotional regulation. With a knowledgeable doctor, testing may include antibody screening or other evaluations, and treatment often involves leucovorin, a form of folinic acid that can cross into the brain. Leucovorin does not cure autism, but for some children, it reduces symptoms driven by folate deficiency and improves quality of life. Medical issues more broadly should never be overlooked. Iron deficiency can cause fatigue, irritability, and attention problems. Thyroid issues can affect development and mood. Seizures can be subtle and easily missed. Gastrointestinal pain, reflux, or chronic discomfort can make a child appear dysregulated. At home, parents may notice food avoidance, sleep disruption, or unexplained distress. With a doctor, lab work, imaging, or specialist referrals may lead to treatment that significantly reduces suffering. Here is the key message: you do not have to choose between accepting autism and treating medical or developmental issues. These things can exist together. Treating what is treatable does not erase autism. It reduces unnecessary burden. Ask for a full evaluation, one that includes hearing, vision, sleep, medical screening, and developmental assessments. Ask about speech, attention, anxiety, and trauma. Ask about conditions like cerebral folate deficiency when symptoms suggest it. And if your child is autistic, that remains true and valid. Autism does not disappear because you address sleep, hearing, anxiety, or metabolism, but when treatable issues are addressed, many children experience less distress, better communication, and more access to learning and connection. Hope does not mean denial. Hope means using every tool available. You are not late, you are not failing, and your child is not hopeless. Understanding opens the door to real support.